What's up, everybody? I am your host, Keisha from Put Your Phone Down podcast, and I have a special guest right now who is going to inform us about all the things you need to know. I plan on asking Dr. Potter about lupus, about fibromyalgia, about diabetes, and this is the perfect one to ask for something like this. It is very important that we get educated about these autoimmune diseases. And we just had an awesome conversation. I will not hold anybody any longer. I have Dr. Potter on the podcast who is going to explain to us. He has over 30 years experience in what he does. Welcome to Put Your Phone Down podcast, Dr. Potter.
Thank you. I appreciate it.
You're very welcome. So I know we spoke about, just different things. And I know you said, Keisha, I would like to basically speak about your background and the African American community. I want to put a disclaimer. This is not at all just for African Americans. I want it to be for everybody who can get something out of it. But by me being African American, I wanted to speak to my community. So, can you please give us some background on what made you get into this healing business? That's basically what it is.
Yeah. As you can tell, I'm not from the U.S. I grew up in India. I speak American Midwestern English, but I grew up in India. And I grew up in India at a time right after India partitioned with Pakistan. And hundreds of thousands of people were killed in that transition period when India separated from Pakistan. This was after the Brits left. My family relocated to the US because India was becoming communist and we were rapidly descending into communism. Um, and we didn't want to be in a communist state. So we came to the United States. My father's a physicist, my mother's a mathematician, and I grew up in St. Louis City after the age of 8 or 9. And I grew up in downtown St. Louis City in the projects. I grew up in a place called Laclede Town. I didn't know that there were white people in the United States. I hadn't met any at first because all I saw were other kids. Now I happen to be brown and they happen to be a little bit darker. I happen to have a turban and I couldn't speak English and they speak fluent English, but I didn't know that there were, it was only on television that I realized there was a whole other population of people because I grew up watching Sanford and Sons and I grew up basically in Laclede Town. Now, eventually, we moved out of Laclede Town, and I ended up completing my education in the county, and that's the first time I ran across more than two white people at a time. So it was odd. I didn't quite grasp it. I'd always loved science. I'd always loved technology, um, and ended up going in medicine. But I ended up wanting to really give back to my community, and because I was from India and I was a kid and I couldn't speak the language, I spent a lot of time introspecting and being quiet and observing. And it gave me an opportunity to look at people and not just look at them, but see what they were doing. And because I was cross cultural, I was from India, I was with an African American population, and then I was with a predominantly white population. And I could see the differences in the communities. And I could see behavioral, and I could see nutritional, and I could see wealth, and I could see shifts in demographics. And it led to some conclusions for me as I grew up. I eventually went to medical school and graduated, and I always wanted to give back to my community. So that I relocated back into the central core of St. Louis, and that's where I've been doing at first anesthesia, then interventional pain, then obesity and addiction. And so I've always tried to help the community that helped me at first when I first moved to the U.S. Um, I think there's some things that we have to recognize, and they're hard truths that have happened. And I think that I want to directly speak to your African American population that is a good chunk of the people that listen to your podcast. And I'm going to put it in historical context. So some people will get mad, and I think that's okay. But I can tell you that in the 40s and 50s, the divorce rate amongst African Americans was lower than the divorce rate amongst white people. Average African Americans had a higher household income than Caucasians. It was the 60s and 70s that shifted. And by the late 70s, because I was born in 1964, by the late 70s, late 70s, mid 70s, early 80s, it had completely shifted. And it was the change in the way that we paid people and the way that we helped people take care of their families that shifted the marriage complex in the African American population, and it encouraged the separation of the household. It said, hey, if you have a father in the house, we're not going to give you as much money as if you have a single mother in the house. And at the same time, we said, hey, you know what? We're going to give you food stamps, and those food stamps will allow you to buy food because we're going to try to help you. But the problem is the food that we're going to give you is preserved, and it has a lot of vegetable oil in it and a lot of carbohydrates and a lot of sugars. And we're not going to tell you this, but it causes a really bad addiction. And the vegetable oil makes you get terrible ADD, and it makes your brain become impaired over time. In fact, to the point where some of the components of vegetable oil make your oxytocin levels go down, and that's the hormone that makes you bond with your baby. And so the more vegetable oil you have, the less bonding you have to your child, and the less bonding you have to other people, and the more loneliness that you have. You've already separated the husband and the wife, and now you're separating the child from their mother. And all of a sudden, you're feeding them a diet that triggers a dopamine release, and now they're bonded to the food instead of to the people, and you get obesity. And all of a sudden, as you increase the amount of pollutants in the food, you cause leaky gut. And leaky gut triggers autoimmune defects. It causes your intestines to become inflamed. It causes lipopolysaccharide, which is stool material, to go across your gut membrane and end up in your bloodstream, which causes you to trigger lupus. And it causes you to trigger fibromyalgia. It causes you to trigger diabetes. It causes you to trigger arthritis. Well, what's the point of all this? Well, it's interesting. We start off with populations of African Americans who have a lot of money. They come back from World War II, and they have stable communities, and they own their own houses. They're a population that has wealth. In fact, Wall Street for African Americans was in East St. Louis, and it was as wealthy as the Wall Street was in New York almost. But we bombed the crap out of it. We destroyed it as a nation. We separated African Americans from their wealth. We separated them from each other. We redlined their communities and took away their wealth. And when we separated out those communities, it created a problem. We incarcerated the youth and gave them felonies so they couldn't vote. We took away their ability to participate in a political system. So all of this stuff, I don't care if you're telling me that it was done incidentally, it destroys the community. It separates the community from health. It separates them from power. It separates them from wealth. And the combination destroys the community. And that's what I'm trying to help restore in the community as best as I can.
I love the way you broke that down. And I know at the beginning you said you might make somebody angry. I don't see how because that's actually how it went. You know, the broken family and the food stamp. And then you have to look at pretty much the grocery stores in the African American community. You know, when you go to these grocery stores, you might not see, the same things you see if you drive a few minutes or even an hour or so down the road, where you see nice bright lights and beautiful fresh fruit. In the African American community, it's usually outdated, over processed food, you know, and that's what we gravitate to. Think about Thanksgiving. Most people are going and get the chitlins and the fried chicken, and these are things that most African Americans love. However, when you go to the grocery store, that's pretty much all we have. So I love the fact that you broke that down because it's history, and it pretty much merges together while we're here. The conversation needs to be had no matter what. The things that you mentioned, I mind blowing. I know when I look back at this, I'll see my facial expressions, but you mentioned vegetable oil pretty much having something to do with, I believe, the inflammations of our joints and the disconnections, like you said, we may have or we do have with our children. So I wanted to dive into that, like you mentioned lupus and all of those things. Before we go any further, I wanted to touch on the fibromyalgia. Now, I wanted to get that, and I wanted to give a small clip, an intro, a segue to this conversation. One of the things you mentioned is that it's since been republished, but I got this clip from I have to look down at my notes. Keto Genetic Diet Show. I have to say that that's on YouTube. And I noticed that one of the things that you said in quote, and this is one of the things you mentioned, is growing up in the world of crises, you learn to observe subtle clues that your very life depended on it. So this is all marrying one another. I'm going to go to this clip and you're going to educate us about the fibromyalgia. Okay? So here we go. Step number one, education.
Understand why I still think it's a valid study. What they did was they looked at patients who were diagnosed with fibromyalgia, diffuse myalgia pain, diffuse joint and tendon pain over their entire body. And they looked at these patients and they looked at their hemoglobin A1Cs and their insulin resistance ratios. They looked at their LPIR scores. And they found out that the vast majority, over 95% of them, were pre-diabetic. And if they treated them with metformin, 2/3 of them no longer had joint pain in 6 months, no longer had tendon pain in 6 months. Now, that doesn't mean that these patients didn't have fibromyalgia. Fibromyalgia is a symptom diagnosis. What it means is fibromyalgia is precipitated by a pre-diabetic state. And so if you look at it closer, if you look at it deeper, you find out that they have severe metabolic inflammation or something called meta-inflammation. And if you look at it even deeper, you find out that their omega-6 to omega-3 ratios are wrong. And so they have way too much vegetable oil, not enough omega-3, and they have a high glycemic index and a high glycemic load constantly, and they're pre-diabetic. And so the reason why the study was retracted is that they didn't give them enough consent.
Now that's an earful. That's an earful, Dr. Potter, because it sounds like the vegetable oil plays a huge part, in these diseases that we're developing. I wanted you to go a tad bit more into fibromyalgia, and I had a question submitted to me. Someone who has it and has been suffering with it for a while. They said, I've been on the same medication for 10 years. What can be done? So can you explain to us what fibromyalgia is and what can be done for someone who has been medicating themselves for over 10 years with the same medication?
Yeah, so fibromyalgia is fundamentally a disorder of metabolism. It's a disorder of essentially prediabetes. Secondarily, it has other things. But we know that if you use an anti-diabetic medication like metformin, it actually turns off fibromyalgia. And we know that the patients who have fibromyalgia have something called insulin resistance. And we also know that they're more likely than not going to become fully diabetic. So what we try to do is we try to, instead giving them narcotics, instead of giving them pain medication, we fix their metabolism first. And I have to tell you that metabolic dysfunction presents in 93% of Americans. It used to be 20% of Americans, and now it's 93%. That's a big difference. And that happened, it went up to 80% in the late 70s, early 80s. 1979 is when it started shifting big time. And that's because of the dietary guidance that the US government gave to the human population in the United States, saying, you know what, you can eat vegetable oil, but don't eat butter, and carbohydrates are okay. And you can eat processed food. And that's the exact wrong answer. And so it was in 1979 that you really saw this rampant increase in metabolic inflammation to the point where it got to 80% of the population, and now it's 93. And in fact, if you have pain, you have a 99% chance that you have a metabolic dysfunction. And that's a big deal. Only 1% of not of pain patients are metabolically healthy. And they're usually the ones that just had a car accident that are bodybuilders or, runners or something. But the rest of everybody that has chronic pain, they have a metabolic dysfunction that we have to fix in order to get rid of their long-term pain. So, what we typically recommend is get to the underlying cause. And that typically is prediabetes. Now, there's other factors as well. And I mention vegetable oil a lot because it's the hidden thing that nobody sees, but it's everywhere. In fact, they add brominated vegetable oil to soda. I mean, why would they add a vegetable oil to soda? Well, because it makes it more addictive. And if you add, so there's two components of soda that are a problem. One is the vegetable oil that they sometimes will add, and it's a brominated vegetable oil. It has bromine in it, and there's no reason to even have brominated vegetable oil. You have to create that stuff. It makes the soda taste more citrusy with a chemical. At the same time, it probably dissolves some of the plastic that's in the bottle and increases your plastic load. And right now, 99% of males in the United States have plastic in their testicles. We can pick it up. We can see the microplastic in their penis and in their testicles, which explains why there's such a high rate of impotence in the United States. But that's separate. That's a separate issue we can talk about. But so there's two components in sugar sweetened beverages. One is certainly the vegetable oil, which is in some of them. But the other component is the sugar. And it's not just the sugar. So like if I go and get some table sugar and I look at it, it's a disaccharide. That means that each molecule of table sugar has one glucose and one fructose. But that's not what's in a sugar sweetened beverage. It's not one to one. In a sugar sweetened beverage, they use high fructose corn syrup. High fructose corn syrup is usually like 52%, 53% fructose and 47, 48% glucose. But that's not what the soda companies are giving you. They're giving you 55%, 60% fructose. They're spending extra money to increase the fructose. Why would they do that? Well, it turns out that fructose is hyperaddictive. It makes you want to Jones every hour and a half to have another soda. It's a consumption behavior that they want you to have. They want you as addicted to that as crack cocaine. It's just a different form of crack. And they've purposely done this. And they're not using just regular high fructose. They're using high fructose corn syrup. They're spending extra money to increase the fructose to do that. And it's just plain wrong. But it also causes you to become more insulin resistant in your brain because you consume it all the time. And what's happened is that kids right now are drinking 4 to 6 sodas a day. That's hundreds of grams of sugar. And some people think, oh, I'm going to drink a diet soda and that's healthier for me. Well, diet soda is not healthier for you because it destroys your gut health. It destroys your gut bacteria and it allows you to get lipopolysaccharide across your gut wall. It allows bacteria to get into your bloodstream and it causes a secondary side effect of making you have fatty liver. It causes your insulin level to go up and it makes you more insulin resistant. And it actually increases your risk of getting diabetes by having artificial sugars. So it's a terrible conglomeration of terrible things that we've done to our dietary intake. And if you're the average person, you've got a problem. Do you know, who do you think is the largest recipient? Who do you think sells the most amount of sugar sweetened beverages in the United States right now?
I would think sodas.
Yeah, it's sodas, but it's Walmart. It's
Walmart.
Walmart
Okay.
is the largest recipient of processed food in the United States because they're the ones that get the most amount of the revenue dollar from processed food. Do you know that it's cheaper to buy soda than it is water at
Yeah.
Walmart? It costs way more money to buy water, but you had to add all this other crap into the soda. You would think that the soda would be more expensive, but the water is way more expensive.
And you know what? You're right. It's like when you're going shopping, sometimes you see water might be, let's say $5, but you'll see the diet pop, and we thinking it's a sale. Like, well, I'll just grab the pop. The water is more expensive, and
Right.
then you got to think about inflation. So you think you smart shopping when actually it's that gimmick, it's that money grab.
Yeah, because they know they got you hooked. They
Yeah,
got you addicted. And then once you get the soda and you get a high insulin level, you're going to eat food. You're going to eat from the time you get up in the morning to the time that you go to bed at night and maybe in the middle of the night too.
yeah.
And so, the worst meal of the day for you typically is breakfast because it's the one with the most amount of carbohydrate. And carbohydrates will make you hungry again in 2 hours. So in my patients, I discourage them from having breakfast. I say, look, condense your eating window to a smaller window and don't eat carbohydrates. And I have most of my patients that I deal with off of almost all carbohydrates, and we have them eat real food. We get them away from processed food because at the end of the day, I'm trying to get my patients permanently healthy. I don't want them to have to need me. I want them to be able to return to health. And you can't return to health if you're eating ultra processed foods.
So how can we reverse this? A person with lupus or fibromyalgia, if they want to pull away from medication. Uh, how do we start with this? The reversal, I would think, would be the hardest part.
So we're doing this every day. I mean, you hear about patients that are type 2 diabetics and they're going to be diabetics for life. That's not true. I can tell you the vast majority of type 2 diabetics, we're able to get them off of insulin in 3 or 4 months. We're able to get them to lose weight. If you use your regular standard protocols of going to your doctor and they tell you, look, just eat less and move more, the chances that that succeeds is one chance in 167 to one chance in 254. If you follow our protocols, your chances are 8 out of 10. And we don't use Ozempic. We don't use Wegovy injectables. We don't use GLPs. The reason why we don't use these drugs for the injectables is because they make you stop eating. And when you stop eating protein and you lose your muscle mass first before you lose your fat. And then when you get off of the drug, when you got to the right weight, you regain your fat mass, but you never regain your muscle. So you're actually sicker after you afterwards than you are before because you've lost all your muscle mass. And it takes 6 weeks to recover what 1 week of muscle mass loss does to you. So you have to work out for 6 weeks to regain that 1 week of muscle loss. So we don't use the injectable Ozempics and Mounjaro and those drugs. We change diet instead, and we reverse our patients' diabetes. And we're very specific about how to do that. And we go to almost a near zero carbohydrate diet. We use real food, and we reteach people what real food is, because that's something that we've lost. We want you to eat like your great great grandmother, not like your grandmother, but your great great grandmother. We want you to go back and think about what food was before the 1930s. Um, I don't know if you realize it, but Crisco, which is vegetable oil, it's that clear, it's the stuff that's white, and you get it in a big tub. That's vegetable oil. Margarine is vegetable oil. Um, these vegetable oils, the hydrogenated solid vegetable oil, that was actually a patent bought by the company that does vegetable oil. It was a patent bought from the Nazis, and they incorporated that into the United States. And they did a marketing campaign to housewives telling them that eating tallow or butter was bad. and it was dirty. And you should use this new chemical that's clean and white. And they sold it as a sterile, clean, white chemical that was healthy and would make their cakes taste flaky. And how butter was so bad because it was from an animal. And so it's this very interesting. It's more a marketing message. Like breakfast is the best meal of the day. That's a marketing message. It has no basis in science. It's purely a marketing message. And so, what we try to do is get people to eat extremely healthy, like their great great grandmother did. And so
And
we're going back 2 generations, 3 generations.
I'm thinking the great great grandmother was out in that garden, like they were the ones that was, planting their foods, and then somehow there was a shift change where, fast food became the go-to, deep frying our food, over seasoning our food, it's like,
Well, I mean, just think about this for a second. If you're a kid in the United States and you're living in an urban community, you're terrified of going out at the end of the day because there's a lot of gun violence. There's a lot of local violence. There's people out there that could hurt you. So you're sitting in your house, not playing outside. If you're African American and you're not playing outside, you're not getting sun exposure. You live above 36 degrees latitude. We got a problem because you're going to be having a very low vitamin D. And vitamin D is not a vitamin. Vitamin D is a hormone, and you need it to form your brain. So if you're living outside of the equatorial zone and you have dark skin and you're not outside, you have a problem because you're going to be vitamin D deficient.
which
And
is what most African Americans
yeah,
do deal with, the vitamin D deficiency. And
because they're not in
oh
the
my
sun.
God, yeah.
And the next thing that's cropping up in the African American population, I mean, obviously we've talked about loneliness, and this is a wide ranging subject. I mean, I could talk for 8 hours, but the next thing that's happened is the neuroinflammation and the inability to perform at school. If I load you up full of vegetable oil and sugar, it's unlikely that you can hold two thoughts in your head for a long period of time, and you're going to be labeled as ADHD. And either you're going to be medicated, or if you're not medicated, you're going to get kicked out of school. And eventually, you're going to quickly shift from being disruptive in class to being labeled as a criminal. You get labeled as a criminal, you get segregated, separated, and then eventually you interact with law enforcement. And when
So
you do that, you lose your voting rights.
it links in with the food
Hmm.
because,
It's
yeah,
redlining.
I see it in kids all the time and adults. Adults are now being diagnosed with ADHD. They just spent their whole
Anxiety.
time going through school, and all of a sudden, we blame it on getting older. But yeah, it is one of those things where it's like, okay, I can't remember what I just did or what I said, but all it all starts with what's in our food.
Yeah, it's you can't fix a problem where you eat 2 pounds of a food with a capsule that weighs, a milligram. 2 kilograms or a kilogram and a half of food, 1,000 milligrams, 2,000 milligrams of food against 1 milligram of a capsule. How are you going to fix that? You got to fix the food problem. So there's a bigger issue at play here, and that is that the food supply is terribly damaged, and it's been organized for the big food companies to make a ton of money. And the only way they can harvest that money is from people, because they don't just get the money. So there's a trade that they have to make. So they make hyper palatable food to make people consume more of it. Like if you get a bag of Doritos, if you've ever had a bag of spicy Doritos, you look in there and you think, oh, these are Doritos. Each one of those Doritos has a different flavor slightly. They have about between 8 to 15 flavors in a bag of Doritos. And each one is subtly different. And that's why it's hard to stop eating them, because you have one and you put it in your mouth and you go, that was good. You have another one, it has a slightly different flavor, but you can't tell the difference. But your brain can. And it goes, that was better. Then you have another one, and that was a different flavor. And they go, that was even better. You never hit satiety because it keeps switching the flavor profile. And it's called a Dorito effect. And that's what hyper-processed food does. They subtly modify the food so that you never hit satiety because they want you to keep eating.
And I can believe that. I'm so glad that you ripping the band-aid off of this because I wanted to touch on kids and adults and like you said, how we're eating. Dr. Potter, I can promise you, I can go into a predominantly African American, let's say gas station, and all I see on the shelf is chips, salty chips. That's the marketing scheme. You go down a little further, you see the snacks, the jumbo snacks. Like it's not, I remember an oatmeal cream pie being that small. Now they only selling it the jumbo size. Snickers, jumbo Snickers. I can drive down the street to an area that's not predominantly African American. And I'll see healthy little, sandwiches off to the side. It's other choices. So can we dive into the kids? Now we're seeing kids that, are, in my opinion, overdeveloped. The young ladies have breasts at 7, the young men are pretty much growing and developing, being husky, as we call it, but they're eating these flaming hot every day, all day.
Well,
Um,
it's two things. I would tell you that I agree with you as in terms of the earlier maturation of girls, and their age of menstruation is getting younger, and they're getting much more mature. But the other thing you're going to notice in girls is they're getting more masculine.
yeah,
And
aggressive
then,
too.
and what you're going to notice with boys is they're getting more feminine. And that's not made up. What's happened is it's the microplastics in the amniotic fluid around the baby, and it's parts per billion. And those microplastics are estrogenic. And if you expose girls to estrogenic material when they're in utero, it increases their maturation. And then you combine it with food and other things to make them mature faster. With boys, what it does is for a population of boys, they may get early huskiness, but they quickly will also become more feminine and more emotional. And there's actually a study on this. It's called the anogenital distance. It's the area of the taint. It's the distance between the anus to the bottom of the testicle. It's shrinking over time, and it correlates directly with the amount of microplastics in the amniotic fluid and the feminization of the population. And right now, 20.6% of the population doesn't even know what gender it is because it's feminized. They don't know because they got exposed to estrogens in the uterus and they don't know. And it's not just the human population. It's the same thing with polar bears. We've measured that anogenital distance on polar bears that eat seals that end up eating microplastics. And we can measure the microplastics in the polar bears. And we know that their anogenital distance is shrinking and their sperm count is decreasing and they're becoming less masculine.
So how does that happen? Like, is it the things that the pregnant women are ingesting,
Yeah,
or
it's in the plastic bottles. You're getting microplastics from the plastic bottles. It's
okay?
contaminating all your food.
Oh my goodness. Okay. This just took a whole different route. So it's true what they talking about with the plastic bottles. I believe it's the BPA.
Yeah, but it's
Uh,
not just the BPA. That's just
okay,
one of them. There's about 400 compounds that are unregulated. And you only know about BPA. There's BPC, BPB, and there's all kinds of bisphenols. And if I because we do this. I mean, if you end up looking at, they did a great study, and they did a study on men, and they did biopsies of their penis because they were doing something else, and they found 100% of the men today have microplastics in the wall of their penis, and that comes from the food that they ate. 100%. I'm not talking like 50%. I'm talking 100%. 100% of young boys in their testicles have microplastic.
so that would be in the Gatorade that they're drinking.
Yeah.
So
Exactly. It's and all those plastic bottles.
what's the switch over? Glass bottles or plastic cups, or what's the switch
Glass
over?
bottle and stainless steel bottles.
There we go. Okay. So I just wanted to put that out there. So the
Yeah.
Stanley cups are pretty good, or
Yeah, use glass or stainless steel.
Okay.
Yeah.
So I wanted to also touch on, because I know we're getting close to wrapping up, but I wanted to touch on so many things that you mentioned. A lot of people are dealing with migraines these days. Is that connection with the vegetable oils and the different things that we are experiencing with the food?
There's a relationship, but there's a couple different things. It's certainly food related, a component of it. Part of it is genetic, and part of it could just be cervicogenic. It could be from the back of your skull, and it could be damage to the joints in your cervical spine, which trigger occipital neuralgia. Um, and you have to also understand that the more estrogen you have, the more likely you are to have migraneous headaches. And migraine headaches are really a type of seizure disorder inside the brain without having the grand mal seizure. And it also has to do with blood flow and leaky blood vessels in your head. So there's a whole host of things that we do for patients. And we work with those patients to reduce their migraines. It's pretty complicated. It's the migraine headache is really the tip of the spear. It's one of the more challenging things. We have all kinds of drugs that we can use on them, but our goal is we use the drugs temporarily and then we fix the underlying lifestyle issue. Because long term, we want people, I mean, we don't want people to have to be stuck with a lifetime of medication. We want them to be able to self manage.
This has been such an awesome episode, Dr. Potter. I had all these notes written, but then I just got so caught up in just the information that you provided. It's way more than that I had on my notes. So I'm so thankful for that. What is it that you would like to leave for the patients that are dealing with the lupus and the fibromyalgia and, diabetes? Is it something that you can give them where they can start now? Like I said, the young lady that submitted the question about being on pills, same pill for 10 years. Is it something that she could notice to stop or start doing immediately? What
Yeah.
would you leave for these patients?
So the first step is a dietary intervention. I would go to one of our websites. It's called www.reversediabetes.md. Totally free. It's got protocols on there and it's got videos, but it's got protocols that you can follow for dietary intervention. That's step one. And then there's other things that we can do to really make a difference in people's lives. I mean, people have like profound anxiety. They have, they're on anxiolytics. They can't sleep at night. That people have PTSDs. 40% of my patient population has PTSDs. Um, PTSD sticks to you longer if you're metabolically dysfunctional. And so if you've had an abuse situation, which the reality is, as human beings, we've all had something that's happened to us that's a terrible thing. Most of us, we just outgrow it and we keep moving forward. But 40% of people don't. And it's really worse if you have neuroinflammation. So what we try to do is calm down that neuroinflammation and change patients' gut health. For example, anxiety and sleep. It's really driven by GABA aminobutyric acid. And it's through the vagus nerve that goes through your neck and it calms your brain down at night. So we change people's GABA in their gut to change their gut bacteria to calm their vagus nerve down to allow them to sleep better at night. And that's to get them off of the Ambien or whatever sleep aid they're on. So they're all kind of medical protocols, but the goal is to reverse the fundamental underlying disease process and make a big difference there, and to identify early. If you could identify early, you can have a huge difference. Let me give you an example. If let's say that your family has a high risk of having Alzheimer's disease or cognitive impairment. Alzheimer's is really type 3 diabetes. It's diabetes of the brain. If I do a genetic test and you're ApoE5 gene positive, homozygous, you have a 95% chance of getting Alzheimer's. And there's a drug that we can use to help you. It's 1% beneficial and it costs $85,000 a year.
Hmm.
Or I can change your diet and it's 40% beneficial and it costs nothing. Personally, I would do the 40% because I can get 40% improvement without doing anything else. And if I can avoid getting type 3 diabetes in my brain, I might never get the symptom anyway, and I can save myself 85,000 a year. So I mean, there's a lot of stuff that we can do, and most of it's just returning people to health, returning to them, turning the clock back, and back to where it was 80 years ago on dietary intake. And that's where I want to get people back to health again.
That's the goal. I had no clue it was a diabetes 3. So is it a higher level of diabetes 2? Like, does it go 4 or?
No, it's just diabetes type 1 is the traditional childhood diabetes where kids don't produce insulin. Diabetes type 2 is we produce too much insulin and we become insulin resistant. And it's the typical diabetes that we see in adults. But now we're even seeing kids with diabetes type 2. And diabetes type 3 is considered diabetes insulin resistance in the brain. And PCOS is another kind of diabetes. Polycystic is another kind of diabetes variant. Fibromyalgia is another kind of diabetes variant. Cancer, the majority of cancers are a variant of diabetes. Insulin, it's a growth hormone, it causes the growth of cells. That's what cancer is. So a lot of cancers are associated with being pre-diabetic or diabetic. And so we can calm that down.
So I wanted to ask you, and I'm sure the listeners want to know, you are in St. Louis, one of the best doctors that I've read up on. I mean, we just got to the tip of the iceberg with you, Dr. Potter. You are one educated and gifted man. So I want to thank you so much. Can people from Indiana come on and see you? Can they hop on the road? Are you seeing new patients?
Yeah, we see patients every single day. And we for some patients, we'll even telemed in with them. But the majority of patients, we want to see them. We want to actually lay eyes on them to figure out and guide and help. I mean, I look at myself more as a Sherpa, like somebody that like is a coach. I certainly do medicine, but it's more than medicine. What I'm trying to figure out is how do I help somebody return themselves to health. And so for me, it's more of guiding people back to where they're supposed to be, and saying, hey, this is what we know worked in the historical context of human beings for 2 million years, and we've only had this crap for 40 years. So let's go back to where we were 70 years ago because it was good for 2 million years. And so that's what we're trying to do.
Okay, so where can these people find you? You got any social platforms or any websites that you want to give us information on?
Yeah, I mean, if the easiest way, if you want to direct reach out to me through our pain site is painmd.tv, www.painmd.tv, and that's got tons of information and our direct phone number. But if they just want to learn about diabetes and reversing it, that's reversediabetes.md. And then we're on all kinds of social media platforms. I don't really personally get on them, but my folks will post to them to educate. LinkedIn is probably where I spend most of my social time on, which is just answering questions from other physicians. But a lot of patients will get on there and ask questions because I'm really trying to. For me, it's if I can educate other physicians. I do a lot of national meetings and I educate physicians. If I can educate them, then they can take care of their patients, and then we don't need to. If I can get other physicians up to speed, then they've got 2,000 patients they're going to help directly. And so I've probably interacted with a couple thousand physicians in the last few years, in the last 15 years, and we try to educate them so that they can educate their patients. But we directly also treat, and I've got about 5 physicians here that in our practice that this is all we do.
So one more thing before,
Mm-hmm.
what could be the replacement for vegetable oil? I know some people use peanut oil. What's the replacement to have these people just start something new?
Butter,
Butter.
butter, ghee, whatever you do, stay away from peanut oil. And let me
Okay.
tell you why. When you have peanuts, the first year you grow a peanut in the soil. Well, peanuts aren't nuts. Peanuts are a legume, and they absorb all the nutrient from the soil and everything else in the soil and condense it into this kind of pea that we dry out, and then we crush it up and we extract the oil, or we turn it into peanut butter. But it's not a nut. The next year in that same soil, we typically will plant cotton in that soil, and we'll spray the crap out of the cotton with herbicide and pesticide. The third year, we plant peanuts again. And all of a sudden, we picked up the herbicide pesticide from the cotton from the previous year, and now that's concentrated in the peanut. So now you're eating herbicide pesticide. The fourth year, it's back to cotton. The fifth year, it's back to peanuts. Now you've got double concentrated herbicide pesticide. By 10 generations, you're getting nothing but herbicide pesticide and some oil, and it's vegetable oil. And so it's not what I want you to have. I want you to have, if you're going to have oil, it should be ghee, it should be butter, it could be avocado oil, it could be tallow. We have a whole list, and if you go on reversediabetes.md, it goes through those lists and kind of explains how we came to those conclusions and what we recommend. And it's all free. There's no charge on that site at all.
All right. Well, I, for one, am about to get my ghee butter. I've had some before, but of course, I've always went back to, oils because that's what I grew up on. Like you said, Crisco, and that was the commercials back then. You
Yep.
see them have the Crisco commercials and frying that chicken, you knew what to go for. So you have just educated us and gave us food for our souls. I really want to thank you so much, Dr. Potter, for hopping on Put Your Phone Down podcast and letting us know that you are pretty much the hero of St. Louis, and we want to come and visit you. You guys, the information he provided is, like you said, the website. You can find him on LinkedIn. Thank you so much again for hopping on the podcast. I don't have any more to say, but thank you.
All right. I appreciate it. Thank you so much for letting me on here to chat.
No, it's not a problem for my listeners. This is on all platforms. So look for us on YouTube, Spotify, iHeartRadio. Pretty much Put Your Phone Down podcast is everywhere for you to listen to and for you to get educated. I'm your host, Keisha. This is Dr. Potter, located in St. Louis. You got your information, you guys. So for my people with the lupus, fibromyalgia, is the information that you need. Till next time, you guys, I thank you. Once again, I'm your host, Keisha, from Put Your Phone Down podcast. This is Dr. Potter. Thank
Thank
you.
you.